So here's some guidelines. I say if you're getting above 35, 40 aligners, you decide you may want to consider referring that case out. Second, start more cases. Educate and scan every patient possible. Don't cheat yourself. Get better educated at Invisalign, get better educated at Propel, learn how to do more advanced cases, and don't be afraid to say yes to a case. But once you get above that 35, 40 aligner threshold, that's where it's time you might want to consider saying, you know what, maybe I'm going to refer that one out because it's not profitable. You need to improve your case compliance. That is the number one cause of failure in cases is patients not wearing their aligners. What can you do to motivate your patients? Possibly charge them for their non-compliance, but also make up for the gap of their non-compliance with some of our auxiliary techniques that we're going to talk to you tonight about, like V-Pro from Propel. Once again, you can recover from that non-compliance versus going into refinement by superseding your aligners with a V-Pro, which we'll talk about, which I will do all day long to get the patients back on track versus scanning the patients and getting more free aligners. By the way, those aligners are not free. You do not pay Invisalign for additional aligners up to 5 years, but those aligners cost you a lot. If you're taking impressions, $25 per impression. If you're scanning your patients, you're taking attachments off, you're putting attachments on, you're taking your time to go and fill out that prescription again. You have to approve that prescription. There's a lot of things that go into those no charge aligners. So Invisalign would love nothing more than for you to get those done in one set of aligners, as would you, as would your patient, as would your team. So whatever tricks or tools you have to use, such as V-Pro to reseat a case that's not completely seated, use those tricks and that way you will stay more profitable.